Another unvaccinated infant in Kentucky has died from whooping cough. It is the third case in the past 12 months where both the mother and infant were unvaccinated. These are the first deaths by whooping cough in the state since 2018. Meanwhile, more than 3,500 cases of whooping cough cases have been reported in Texas so far this year, an 11-year high. The rise in cases there has coincided with a decline in vaccination rates there for the illness. Joining us now, physician and senior public health contributor for Forbes, Dr. Omer Awan. Dr. Awan, what should parents know about whooping cough to protect their children after these latest cases?
Good morning, Laura. Well, I think the most important message here is these are entirely preventable illnesses and deaths with vaccination. Remember, all 3 infants that died in Kentucky were unvaccinated. And on top of that, their mothers were unvaccinated. So these are vaccine preventable deaths. And our concern here is that this vaccine hesitancy that's been permeating throughout the United States is leading to this harm that's being done to our children. You know, children are ending up in the ICU. They're getting ill and they're dying. So critically important for parents to vaccinate their children, not just against whooping cough, but many of these other diseases like measles, for example, that are spreading throughout the United States.
There's also norovirus cases surging right now. How can people protect themselves ahead of the holidays?
Well, in addition to vaccination, many things that we can do are washing our hands for 20 seconds. And that's harder to do than said, right? Because many of us when we go to the bathroom, we'll wash our hands for 4 or 5 seconds. But really, to wash it for 20 seconds, that decreases the amount of germs that we can spread to others, making sure that we're not in confined areas for long periods of time. And if we are, maybe consider wearing a mask, because wearing a mask can be a very powerful tool to prevent the spread of infection. So, you know, vaccination, washing hands, avoiding indoor areas for prolonged periods of time, and potentially wearing a mask if you feel comfortable doing so.
We see all these cases surging, whether it's whooping cough, norovirus, it's flu season. Can you tell us why it matters that CDC health data is taking longer to come out since the government shutdown, and as it relates to all of this that's going on?
Well, the CDC provides public health guidance for physicians and for the American public. And without that guidance, we're essentially flying blind with respect to the guidelines that we use, the public health interventions, like whether or not we need to mask, whether or not we need to get vaccinated, whether or not we should have less social contact with others. These are important public health interventions and initiatives that allow Americans to stay healthy. And without that, it's very difficult to strategize and to allocate important resources, particularly for hospitals and healthcare facilities. So when the government shutdown was happening, we, for example, couldn't track, you know, data on the flu or data on COVID-19, data on RSV, and that hinders our ability to fight these diseases, and we are not able to really fight these and to protect ourselves. So it's a critical problem, and hopefully, if there ever is another government shutdown, they're more judicious about putting the data forward so people in the American public can protect themselves.
Yeah, hopefully we can get some of that data pretty soon here. Doctor, there's also this. Republicans have yet to throw their support behind any single plan for the future of the Affordable Care Act subsidies. This as the deadline to sign up for next year's health insurance coverage comes up on December 15th. Republicans now face the choice of either extending the subsidies or letting them expire, and then they could face the consequences in next year's midterm elections. There are currently several plans being pitched by Congress members, but President Trump so far has not signaled his support for any specific plan yet. He at first was seeming to suggest that he supported extending those ACA enhanced subsidies, then went back on it. So what are some of the possible options for the future of those ACA subsidies, and what could it ultimately mean for families?
Well, Laura, I think some of the things that we forget about the Affordable Care Act is the success that it's entailed for the American public. Remember, this has allowed 24 million Americans to receive health care coverage, many of whom are low-income families, many of whom are pregnant women, many of whom are adults with chronic medical conditions. And not only that, Laura, I think what's often lost is that this protected people with pre-existing medical conditions. We often forget this because if you look 2 decades ago, there could have been a child with type 1 diabetes that was barred from getting health insurance because they had type 1 diabetes. That's not the case anymore, and we've been comfortable because we're used to and accustomed to people with pre-existing medical conditions getting health insurance. So it is critical for Congress to act to allow this to be more affordable. This is really not a partisan issue. This is about getting Americans health care insurance because Americans are tired of paying so much money for health insurance. You know, these premiums have been skyrocketing and rising for a long time, and it's becoming more and more unaffordable. So really important and critical that Congress acts to make a plan. We want to see a plan in place before December 31st.
And if they pursue a kind of health savings account or anything like that, then it could also ultimately have the same effect of younger people going for cheaper health insurance, whereas those with pre-existing conditions paying for more. But these subsidies are also affecting how hospitals operate, particularly in rural areas. What's the impact on those communities?
Well, rural communities are much more inclined to not receive treatment, you know, and to receive this health care plans. And, you know, the opportunity for health savings accounts, this impacts the rich more, right? This is not income-based, whereas subsidies are income-based and they help more vulnerable populations.
Physician and senior public health contributor for Forbes, Dr. Omer Awan, thank you.